Good morning, ladies and gentlemen, and welcome to the seventh section of our conference that is dedicated to adult congenital heart disease in low economic countries. I have the privilege and the honor to co-chair with Professor Kalagos and to have a faculty of distinguished Greek doctors that have left their sign on the path of congenital heart disease in adults. And it's a great privilege for me to introduce Dr. Alexandra Frogoudaki, who is the lead consultant in the adult congenital heart disease department in the second department of cardiology of the University of Athens. She's a specialist in the field, and we are waiting to enjoy her presentation. Dr. Frogoudaki, the floor is yours.
Thank you very much, Dr. Petropoulos, and I would like to thank the organizing committee for the honor to present this very, very special topic. It's an honor for me to speak here today. So I will be speaking about organizing a clinical service for congenital heart disease in a low-income country. We have to define who is a low-income country. So a low-income country is defined by World Bank, a country that has a GNI of $1,000 or less, while lower middle income is between 1,046 and a little bit more than $4,125. This is the World Bank map of low and middle income countries in light purple and deep purple. And let's start with the challenges. There are challenges in low and middle income countries, challenges in food, education, access to healthcare services, healthcare professional and resources. Especially, we can say that health challenges can be infectious diseases, malnutrition, maternal and infant mortality, waterborne diseases, non-communicable diseases, limited healthcare access in rural areas, mental health challenges, polio eradication challenges, and drug abuse concerns. 2023 were published recommendations for developing effective and safe pediatric and congenital heart disease services in low-income and middle-income countries. And we have some barriers to confront, like barriers to access, barriers to patient and caregivers, health system barriers, and of course, government level barriers like lack of advocacy, prioritization of national and global health agenda, healthcare financing system, poor governance, accountability, and cost-benefit assessment for providing congenital heart disease care nationally. Let's have a closer look. In terms of recognition, there is lack of prenatal and antenatal screening protocols, lack of availability of screening equipment and trained personnel, inconsistent well child visits, inability to get remote consultation from high-level cardiac care facilities, and in terms of diagnosis, there is lack of availability of diagnostic equipment, infrastructure, and trained personnel. Problems with referral, there are some countries that there is an ability to recognize need for referral, weak referral pathways, lack of effective communication with referral centers, and of course there is problem with stabilization of the patient and transport, inconsistent access to centers equipped to recognize and stabilize patients, inadequate transport and communication system, and trained paramedic staff with inadequate care provided to patients during transport. And of course, we're going into treatment which is a major component, you have to access the center in order to get treatment, and there is sometimes unavailability of required infrastructure and expertise. And of course, there are problems with follow-up. There is inadequate emphasis on long-term follow-up and counseling. This needs to be underlined, while there is unavailability of remote telehealth, telemedicine platforms to streamline care. What kind of services are needed? Of course, there are several levels of services: non-invasive imaging services, ECG, echo, rhythm monitor, cardiac CT, cardiac MRI, outpatient and patient services like emergency care, pre-surgical care, and outpatient preventive cardiology and congenital heart disease. Cath lab is essential, cardiac surgery and perfusion and anesthesia. Cardiac ICU is a major problem. There is need for very well, let's say, very well equipped cardiac ICUs in order to get good post-operative care with adequate nursing, physical therapy, respiratory therapy, and nutrition, whereas need for blood bank and clinical laboratory, social worker and pharmacy services, patient safety, and of course, there is a need for finance and insurance. So, what are the steps needed towards this major services? We need to recognize at first, and this can be done by a pediatrician or a nurse or community health nurse or even obstetrician and gynecologist, even from community and family. There is a diagnosis and prioritization in terms to how urgent is the cases, emergent cases that need to have an immediate treatment, urgent cases, and elective cases. A referral has to be done by a pediatric cardiologist or community health nurse. Stabilization and transport, very, very important. There is need for referring facility, of course, and transport team, while treatment should be undertaken in a tertiary referral center by a pediatric cardiac team. Follow-up is of great importance in terms of well-being of pediatric patients and transition to adult congenital heart disease care. There are several levels of pediatric and congenital heart service. So level 1 is basic screening for cardiac disease, and there is need for training and education. Level 2 needs, of course, basic transthoracic echogram and triage. Service level 3 needs a diagnosis, inpatient facility, and of course, level 4 is elective cardiac catheterization and cardiac surgery, while level 5 is advanced cardiac surgery and anesthesia. We have to keep in mind that Western model of cardiac care is very expensive and is therefore unsustainable in low-income countries. And stakeholders in these countries must constantly innovate and build a program around their specific needs, resources, and capabilities. There is need for building a culture of safety. So, leaders need to demonstrate commitment to safety in their decisions and behaviors. Decisions that support or affect safety are systematic, rigorous, and thorough. Trust and respect permeate the workforce. Opportunities to learn about ways to ensure safety are sought out and implemented. Issues potentially affecting affecting safety are promptly identified, fully evaluated, and promptly addressed and corrected in order to their significance. Safety-conscious work environment is maintained where workers feel free to raise safety concerns without intimidation, harassment, discrimination, and fear of retaliation. The process of planning and controlling work activities is implemented so that safety is maintained. Very, very important component is the continuum of care for adult congenital heart patients by transition. There's need for transition clinic and appropriate follow-up. Achieving optimal results can be done through charities, medical missions, external collaborations. And I had the pleasure yesterday to be part of this very, very important talk that was organized by Toronto International Adult Congenital Heart Disease Academic Rounds, presented by Farhan Ahmad, who comes from Pakistan, which is not a low, but it's a middle lower country. And the topic of the talk was from charities to congenital heart centers in low and middle income countries. They have achieved, and I will present their work here because I think it's very relevant, and they have achieved a lot. So, Pakistan Congenital Heart Foundation is a foundation that is based on several governmental and charity funding. And the vision is that not a single child born with congenital heart disease remains untreated. The steps they have taken is adding PED surgeries in clinical practice in the country, including pediatric surgical procedure in private insurance, increasing trained pediatric cardiologists in the main cities, increasing personnel, especially congenital heart surgeons and ICU nurses, work on regional and international collaboration with peer cardiac centers, improving neonatal screening and fetal echo for early detection, and improving neonatal and early infant open heart surgery. They have built several projects towards this direction, and I will explain. Project MOVSIN focuses on surgeries happening in the healthcare system, and they have already performed more than 3,700 surgeries and interventions that were financially supported. The mortality rate was 6.5, which was comparable to the international rate. And in May 2023, they achieved a milestone of 1,000 free child heart surgeries. Of course, our chair, Professor Kalangos, may have more input on that, as he's performing a lot of surgeries outside in low and middle low income countries. The Project Daniel overview focuses on medical missions. They had 6 medical missions, and more than 80 interventions and surgeries were performed through medical missions, while there is need for awareness. So they're raising awareness during the annual Congenital Heart Disease Awareness Week, and they are holding several awareness sessions at various corporate entities and educational institutes. And there are, of course, awareness programs. So this is the picture of the operations that have been performed in Pakistan under this foundation, and they have managed to get some land donation. That was September 2021, and 2023. We have this almost finished hospitals. They have. Of course, they had a lot of money spent, and they need more money in order to build the whole hospital, which is going to be dedicated to congenital heart disease. It's going to be 7-story building with 2 operation theater, 1 hybrid lab, 1 cath lab, and they aim to 2,000 surgeries per year, and 1,500 interventions per year. Transparency in these countries is very, very important as well, and there is need for full transparency. So, finishing my talk, I would like to underline what is needed. We need patients, and we need adequate diagnosis. We need access to healthcare services with an adequate referral and a good transport system. There is need for healthcare professionals, very well educated and qualified. And of course, the main thing is a healthcare structured system, and outside funding and charities may have a role in these countries. Thank you very much for your attention.